All right, let's dive into some really cool stuff today. We're talking adrenal glands.
Oh, yeah.
And, they're tiny, but they are mighty. And you sent over some fascinating research on the surgical anatomy.
Mm-hmm.
I'm already thinking this is going to be a wild ride.
You are not wrong. They're so important for so many things,
Yeah.
like managing stress, regulating blood pressure.
Mm-hmm.
And for surgeons,
For sure.
if they're operating in this area,
Yeah.
understanding the anatomy is so crucial.
So let's start with the basics. The research mentions two distinct parts, the cortex and the medulla.
Right.
I remember those terms from way back when.
Yeah.
But what makes them so different?
So it all comes down to the hormones they produce. Think of the cortex, the outer layer, like a busy factory,
Okay.
just churning out these essential hormones,
Right.
like cortisol and aldosterone. Now, cortisol, people call it the stress hormone,
Yeah.
but it does so much more than that.
Right.
It regulates sleep, metabolism, even the immune response. And aldosterone, that helps manage salt and water balance,
Okay.
which of course directly impacts blood pressure.
So if a surgeon has to remove part or all of an adrenal gland, it's not just about taking out a piece of tissue.
Right.
You're thinking about the impact on all these hormones.
Exactly. You've got to anticipate those downstream effects. Now, the medulla,
Yeah.
that's the inner part.
Right.
And that's what gives us that fight or flight response.
Okay.
It releases adrenaline,
Right.
which, as you can imagine,
Oh, yeah.
a major consideration during surgery.
Oh, I bet. I can only imagine the surgeon's own adrenaline pumping when they're in there.
Right.
The research also mentions something about an enzyme called PNMT. Now, what's that all about?
Oh, that's a good question. PNMT, or phenylethanolamine and methyltransferase.
Okay.
It's the enzyme that converts norepinephrine to epinephrine,
Right.
which is adrenaline.
Okay.
Without it, the medulla wouldn't be able to produce adrenaline.
Okay, so we need that for those fight or flight moments.
Exactly.
We've got the cortex keeping things humming along day to day. Right.
And the medulla
It's
there
ready to kick in.
when we need that burst of energy.
Exactly.
Now, the research also mentioned adrenal gland diseases like tumors and hyperplasia.
Right.
What can
Well-
you tell us about those?
So tumors, they can develop in either the cortex or the medulla,
Okay.
and they can sometimes produce extra hormones, which really
yeah.
throws things off. Hyperplasia is an abnormal enlargement of the gland,
Got it.
and that can also disrupt hormone production. These are often the reasons why you'd need surgery.
This is where I find it so intriguing. The research mentioned that if one adrenal gland has a tumor that's overproducing hormones,
Mm-hmm.
the other gland can actually shrink.
Yeah.
What causes that?
It's the body's feedback mechanism at work. The extra hormones from the tumor
Yeah.
trick the body into thinking everything's fine.
Right.
So it tells the other adrenal gland
Okay.
to slow down, like a seesaw.
Uh-huh.
One side goes up, the other goes down.
So surgeons need to take that into account.
Yeah.
It's not just about removing the bad gland.
Exactly.
Got to think about the remaining gland, how it's going to function.
It's a critical consideration. And it can take time for it to recover, sometimes up to 2 years.
That's a long time.
It is.
Okay, let's rewind a bit.
Sure.
Talk about how these glands even form. This embryology section
Mm-hmm.
completely blew my mind.
Oh, it is fascinating.
I mean, who knew these tiny glands take such a complex journey during development?
Well, the cortex and medulla actually come from different types of tissue in the embryo.
Oh, wow.
The cortex develops from cells near the kidneys,
Interesting.
which is interesting given they're so close in the adult body.
Right.
The medulla comes from nerve tissue,
Okay.
which explains that link to the nervous system
Uh-huh.
and that quick response.
Right, right. But here's where it gets wild.
Yeah.
Sometimes bits of adrenal tissue can end up in places they shouldn't.
You're right.
Right.
We call that ectopic adrenal tissue.
Okay.
Imagine you're a surgeon exploring the pelvis
Yeah.
or even near the reproductive organs. Oh, wow.
And you find adrenal tissue.
Talk about a surprise. What are the implications of that?
That's where things can get tricky. These misplaced cells can develop into tumors
Uh-oh.
called extraadrenal pheochromocytomas.
Okay.
They're much less common than tumors in the adrenal glands themselves,
Okay.
but their location makes diagnosis and treatment harder.
Yeah, so that adds a whole other layer of complexity for surgeons.
Absolutely.
They really need to understand embryology.
It's crucial.
You mentioned something earlier about the size difference between adult and newborn adrenal glands.
Yeah,
The research said that they're much smaller in adults.
right. Yeah.
Why is that?
So babies have this special part of their adrenal cortex
Okay.
called the fetal cortex.
Okay.
It's incredibly active before birth,
Huh.
producing vital hormones. But once the baby's born,
Right.
it starts to regress,
Oh, interesting.
eventually disappears.
So that leads to the size decrease. It's
Exactly.
amazing how our bodies change throughout life. We've talked about the function and development of these glands, but where exactly are they located in the body?
They sit right on top of the kidneys, almost like little caps.
Okay.
The right adrenal gland is pyramid-shaped,
Mm.
like a witch's hat, near the liver.
I'm picturing it.
The left one is flatter
Okay.
and hangs out near the aorta and pancreas.
But they're not just hanging out by themselves, are they?
No, they're in a crowded neighborhood
Right.
with the aorta, vena cava, liver, kidneys, even the pancreas.
Oh, wow.
Surgeons operating in this area need to be incredibly precise
Yeah.
and navigate carefully.
It's like operating in a packed elevator.
That's a good way to put it.
Let's talk about the blood supply to these glands. The research went into a lot of detail about the arteries.
Right.
It seems much more intricate than I imagined.
It is. Each adrenal gland receives blood from 3 main arteries:
Okay.
the superior suprarenal artery, the middle suprarenal artery, and the inferior suprarenal artery.
Okay.
But here's the thing. Each of those arteries can branch out in multiple directions, sometimes with variable entry points.
So it's not just about knowing the main arteries.
Right.
You have to understand all the little branches and variations.
Exactly. And these are delicate vessels.
Right.
Surgeons have to be really careful to control bleeding,
Yeah.
especially considering that blood flow to the adrenal glands actually increases during times of stress.
So surgeons have a lot to think about.
They do.
We've talked about the blood flowing in, but what about the blood flowing out?
So that's where the adrenal veins come in.
Okay.
And the left and right adrenal veins actually drain differently.
Oh, really?
The left adrenal vein is longer
Uh-huh.
and connects to the left renal vein,
Okay.
which makes it easier for surgeons to control bleeding on that side.
That's good.
Now, the right adrenal vein,
Yeah.
that one's much shorter
Okay.
and drains directly into the vena cava.
Oh, wow.
That's a major vessel. This direct connection and the shorter length make it more prone to injury during surgery.
So surgeons have to be extra careful on that side.
They do.
It's fascinating how a small anatomical difference can have such a big impact on surgery.
Absolutely. And we're just getting started.
Oh.
We still have lymphatic drainage and innervation to cover.
Okay, let's dive into those next. This is proving to be even more fascinating than I anticipated.
It is, isn't it?
It is.
Now, the lymphatic system, that's like the body's drainage network.
Right.
It's so important for immune function, carrying away waste, transporting immune cells.
How does that relate to the adrenal glands?
So the adrenal glands have their own set of lymphatic vessels.
Okay.
And they connect to these lymph nodes that run along the aorta,
Okay.
called the periaortic lymph nodes. Those nodes act as filters, trapping harmful substances or even cancerous cells.
So if there's a tumor in an adrenal gland,
Yeah.
could it spread through those channels?
You got it. That's a major concern.
What does that mean for a surgeon?
If they suspect cancer,
Yeah.
they'll carefully examine
Right.
and often remove those nearby lymph nodes
Okay.
to check for spread.
So it's like following a trail to see if the cancer has spread.
Exactly.
Okay, on to innervation.
All right.
What about the nerves that supply the adrenal glands?
So they're richly innervated, mostly by the autonomic nervous system,
Oh, right.
that controls all the involuntary stuff.
Yeah.
Heart rate, digestion, the stress response.
The stress response. So that's part of why stress impacts us so much.
Exactly.
Wow.
These nerves come from a complex network of ganglia in the abdomen
Uh-huh.
and connect to major nerves like the celiac plexus, the Blanchnick nerves,
Okay.
even the vagus nerve,
Right.
which is so important for so many functions.
It's amazing how interconnected everything is.
It really is.
But what do those nerves do in the adrenal glands?
Think of them as a two-way communication system.
Okay.
They carry sensory information from the glands back to the brain, letting the central nervous system know what's up.
Mm-hmm.
And they also influence blood flow to the glands,
Okay.
making sure they get the resources they need.
So the nervous system is constantly monitoring and regulating the adrenal glands.
Exactly. It's like a finely tuned orchestra.
Remember the adrenal medulla?
Oh, yeah.
The one that handles fight or flight?
Right.
The research calls it a neuroendocrine transducer. So it converts nerve signals from the brain into hormonal signals.
That's exactly it. Like a
Right.
relay race.
Right.
The brain passes the baton to the adrenal medulla,
Right.
which releases the hormones.
That trigger the stress response.
Exactly. Remarkable system.
This has been an incredible journey. We've covered so much.
We have.
Their functions, development, the anatomy, the challenges of surgery, the new techniques.
It's a lot to take in.
It's amazing how much complexity is in these tiny glands.
And it's all crucial for surgeons operating in this area.
Right.
They need to understand all of it.
To keep patients safe.
Yeah.
It's like they're working on a microscopic level, navigating this intricate landscape.
It is.
Are there any particularly challenging parts of adrenal gland surgery?
One challenge is their proximity to major blood vessels.
Right, we talked about that.
Controlling bleeding there can be tricky,
Yeah.
especially with increased blood flow during stress, like, surgery.
Oh, of course.
Surgeons need to be really skilled.
What about those ectopic adrenal tissues?
Oh, those can be particularly challenging.
Yeah.
They could be anywhere,
Right.
making them hard to locate and remove completely.
So how do surgeons approach those cases?
They often rely on advanced imaging
Okay.
and meticulous exploration.
To get it all out.
Exactly.
It sounds like this surgery requires so much expertise.
It does.
Not just technical, but a deep understanding of the anatomy and potential complications.
Couldn't have said it better myself.
And then you have to consider the hormonal implications of removing the gland.
That's right.
Sometimes you need hormone replacement therapy. It's like a team effort then,
It is.
combining surgical precision with hormonal expertise.
To get the best outcome for the patient.
It's truly remarkable.
And while we've covered a lot,
Yeah,
there's always more to learn.
of course.
Ongoing research is constantly refining techniques,
Right.
leading to new discoveries.
Speaking of research, are there any exciting developments on the horizon?
One area that's really exciting is minimally invasive surgery.
Oh, tell me more about that.
Surgeons are developing new laparoscopic and robotic techniques
Okay.
to do adrenalectomies with smaller incisions,
Okay.
less pain, and faster recovery.
That's great news for patients.
It is.
Are there any specific techniques that stand out?
One that's really innovative is single-port laparoscopic adrenalectomy.
Oh.
This involves making a single small incision,
Right.
often in the belly button,
Wow.
and all the instruments and camera go through there.
It's like keyhole surgery.
That's a good way to put it.
And I imagine it gives the surgeon better visualization.
Exactly. The magnified view allows them to see everything in detail
Wow.
and minimize the risk of damaging nearby structures.
So it's minimally invasive and provides a better view.
That's the idea.
Amazing how technology is changing things.
It really is. And these advancements are always evolving.
Wow.
New imaging instruments, energy sources.
So there's a lot to look forward to.
Definitely. Better and more patient-friendly approaches in the future.
It's inspiring to see how science and technology work together.
It is.
I'm sure our listener is fascinated by this.
I would think so.
This brings us to another important aspect.
Okay.
Personalized medicine.
Right.
Personalized medicine. What do you mean by that?
Well, it's all about recognizing that each patient is unique.
Right.
Their anatomy, their condition, their overall health.
Mm-hmm.
All of that plays a role in figuring out the best way to approach surgery.
So it's not just about knowing the textbook stuff.
Well,
It's about applying that knowledge to each individual patient.
exactly. For instance, let's say a patient has a pheochromocytoma.
Okay.
That's a tumor that can cause huge blood pressure swings.
Right.
Surgeons have to really manage that blood pressure carefully
Yeah.
before, during, and after surgery.
To prevent complications.
Exactly. You don't want to trigger a big spike in blood pressure.
No, that's risky.
It is. And personalized medicine goes beyond just medication.
Okay.
It also means choosing the right surgical technique
Based on what?
based on things like the size and location of the tumor,
Okay.
the patient's overall health,
Right.
even their preferences.
So it's a real team effort
It is.
between the surgeon, the patient,
And other specialists too.
to figure out the best plan.
Exactly. And this is where ongoing research is so vital.
Yeah.
The more we learn,
Right.
the better we can tailor treatment.
And improve outcomes.
Exactly.
This has been such an eye-opening deep dive.
It has.
We've covered so much about the adrenal glands.
We really have. From their functions to their development,
They're
the challenges of surgery.
the new techniques.
It's been quite a journey.
I feel like I've learned a ton.
Me too. It's
Yeah.
been a pleasure sharing all of this with you.
And it just goes to show even the tiniest parts of our bodies are so important.
Absolutely. And for surgeons,
Yeah.
the combination of their expertise, their precision,
Yeah.
and that deep understanding of anatomy,
Yeah.
it's what makes these incredible procedures possible.
Well said. I bet our listener is feeling the same way.
I'd say so.
Huge thanks to our listener for joining us on this deep dive into the world of adrenal gland surgery.
Yes, thank you.
We hope you found it insightful.
And as engaging as we did.
Absolutely. Until next time, keep exploring and keep those adrenal glands healthy.
Could agree more.